if that's possible.
I think Claire's going to record.
Brilliant. Thank you, Claire.
Okay, thank you,
Looks
Claire.
like it started.
Thank you. Good afternoon, everybody, and welcome to the meeting of the East Lothian Integration Joint Board on the 21st September 2023. The meeting has been recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board policies on record retention, and the webcast for this meeting will be publicly available for up to 6 months. Do we have any apologies?
Yes, we have apologies from Councillor Bruce, from Councillor Jardine, from Andrew Cogan, and also apologies from Philip Connoglan.
Okay, thank you. We'll now do a roll call of attendees.
Thank you. Councillor Actor.
Present.
Councillor Maguire, who's here in place of Councillor Bruce.
Present.
Thank you. Is Councillor Gilbert with us? Not yet. He should be joining us in place of Councillor Jardine. Councillor McFarlane.
Present.
Thank you. Ms Gordon.
Present.
Ms Ireland.
Present.
And Mr Murray.
Present.
And non-voting members, we have Maureen Allen.
Present.
David Aston.
Present.
David Binney.
Present.
Lindsay Byrne.
Present.
Is Lorraine Cowan with us? No. Claire Flanagan.
Present.
Thank you. Claire MacDonald. No. Claire McIntosh.
Present.
Thank you. Marilyn McNeil.
Present.
Thomas Miller. And Fiona Wilson.
Present.
Thank you. That's the roll call of attendees done, Chair. Can I just ask if any members have any declarations of interest on any of the items? Nope. That's great. Thank you very much. We're ready to start the business.
Thank you. Move on to agenda item number 1, which is the minute of the meeting of the last Integration Joint Board on the 22nd of June. Can we agree there's a general approval of the minutes? Any notes of accuracy of any? Sorry, general approval of the minutes?
Approved.
Okay. Do you have any matters arising on page 1? Page 2? Page 3? Page 4? Page 5? Page 6? Page 7? On page 7, under point 7, the third paragraph down, there was some discussion around the East Lothian Council and the annual audit Scotland. I'm not sure there was an accurate reflection of what has actually taken place, and I wonder if we get some clarity on that. There.
Sorry, Chair, when you say page 7, paragraph 3, is that the paragraph starting Fiona Ireland confirmed that the draft accounts had been reviewed at the Audit and Risk Committee? She then referred to the recent media coverage. Is this the
Yes, that's the section 4. I just wondered if that.
I thought that was a question at the meeting.
So there's I'm just looking for clarity on that, of what was expressed at that meeting.
Well, I think that is exactly what was expressed. The question was asked and the answer was given by Claire as recorded in the minute.
If I could just ask that if that is an accurate reflection of what actually Audit Scotland said.
We didn't ask Audit Scotland. We asked a question as regards the media coverage and whether that ought to be reflected in our commentary or within our annual governance statement, and Claire responded to that very clearly, that she relied on the letters of assurance from the Council and from the NHS. That's what's recorded in the minute.
Yeah, and that will be provided, but I think it was just to highlight that the media coverage was not factually correct of what was said around as to what Audit Scotland had outlined. And I think that needs to be reflected in the minutes.
I don't think that's a point we can pick up at the time. That is a reflection of the question asked in the minute in the meeting.
I think I would like it reflected that the media coverage was factually incorrect. Okay.
I would go to Fiona Curry to question then, is that a matter arising that you would wish to be recorded in the minute of the next meeting? But that is a factual representation of the discussion that took place in the meeting previously.
Okay. Peter Murray, can I ask you to come in?
Yeah, I entirely understand Fiona's perspective on it, and I just wonder whether or not, rather than spend too much time in it, that we perhaps could acknowledge that there's a query over this matter and have a conversation just to make absolutely certain that any issue that may be reflected in the minute we're discussing needs to be altered in any way, but we do that outside of today's meeting rather than hold up proceedings, because we could go back and forth with this quite a lot. And whilst I don't deny Fiona's account, and I think that probably is accurate in terms of what was said, rather than take up unnecessary time debating some semantics around the words, we could discuss that. We could agree that there's a query over it and discuss that separately out with the meeting. Just a suggestion, Chair.
Yeah, happy to do that. Okay. Fiona Curry.
Could I just say that in terms of the minute of the June meeting, members have confirmed it's an accurate record of that meeting. In terms of today and matters arising, I will, as I would with any other matter arising, record the discussion that's happened just now in the minute of today's meeting, and one can be set next to the other to provide clarification if clarification is required. And the note of today's matters arising will include the fact that Councillor Actor has obviously raised the point regarding the media coverage and her view, and that can be recorded in today's minute.
Thank you. Fiona Ireland.
That was the point I was going to make. The minute has already been approved by the committee. I think this is a matter arising that is recorded separately.
Claire Flanagan.
Yeah, I suppose the main point from the minute from the last meeting that was coming from the question was, should the IJB be concerned, or should something be reflected within the IJB's accounts? And I clearly said no, there's no issue, there's no risk in terms of the IJB accounts, and I think that's the main thing for this board to be concerned around, that actually we have our letters of assurance from both partners. We've been through our audit process. It's not concluded, but we're working through our audit process, and there's no risk to the IJB.
Okay, thank you. Have anything on page 8? Okay, thank you. Move on to agenda item number 3, which is the chair's report. There's quite a few things that have been happening since the last meeting. Yesterday there was a meeting of IJB chairs and vice chairs in Glasgow, which Peter chaired. That was really helpful. There was quite a lot of discussion and debate and presentation on the National Care Service, funding, the SSSC, and the National Agency for Social Work. And if we're able to share the presentations, we will do. And it just seems quite a lot of work still needs to be done on the National Care Service, of what it will look like, what areas it will cover. There still wasn't clarity on children's services and social justice. There was an additional work stream focusing on those areas, but we did get the opportunity at our tables to speak to the team that is dealing with the governance and structures, to give our feedback from an East Lothian perspective of the challenges that we're facing, and that whatever they do, we need the least level of bureaucracy possible within our structures. Peter?
Yeah, you may not already know this. It was just this morning they were sent out, but there has been a composite of the presentation sent out today to those that were there. I don't see any issue with if I send that on to Fiona. She mean that she could perhaps distribute that to the broader membership of the IJB just for information.
Thank you, Peter. That'd be really helpful. I think it's important that you see that and you get that as well. There was going to be a number of other events on the National Care Service, and one of them was going to be in Edinburgh, and I think that'll be in the presentations outlining that some co-production events have already happened, and there's still a few more organised. There was another 3 that were happening. I think one was today, and another 2 up north, that some more events were happening. So I think it's an area that we keep an eye on and just articulate our views from East Lothian, and that we need the least level of bureaucracy, and how do we strengthen and support the good work that integration joint boards have been carrying out, and COVID has meant that there's been far more integration than previously. There has been just a couple of other things. This week there was a dementia-friendly East Lothian event in Haddington, and that brought together the dementia groups from right across the county, and it was to take reflection of the work that's been happening, the establishment of the Musselburgh Dementia Friendly Centre that's now been is up and running, and also in the afternoon there was an opportunity for everybody there to contribute towards the dementia strategy for East Lothian, and it was really positive and constructive, and people were really forthright in their feedback, which was helpful. Another area of work is around the census. We've seen that the census has come through, and I think what we'll do is send out what that means for East Lothian. So between 2011 and 2022, East Lothian's population has grown by 12.6%, and it's the second fastest in Scotland. And I think that's really important that you're aware of that information, and we're using that in our discussions and debates. We've had a development session, and I want to thank everybody who took part in the development session around prescribing and primary care, and we had a good overview around the challenges that primary care face, and I think we'll be returning back to that later on, to see how we support our primary care colleagues. There also was an adult mental health wellbeing networking event bringing across all mental health organisations working within East Lothian, having the opportunity to meet each other, and provide each other support, and making sure that our local residents and citizens are aware of the mental health supports that are there. And Jane Cunningham, who's the mental health strategy officer, was there to support that event. We've also had meetings with Keep the Heed, which are a mental health cafe drop-in across the county, and we had a care and repair board this morning, just looking at ways to support our residents, especially when people are coming out of hospital. But I'm happy to provide any more details of any of those areas that I've covered, or provide more information if anybody has any questions. Okay, thank you. Move on to agenda item number 4, which is the Q1 financial forecast.
Thank you. Firstly, before I go into the financial forecast paper, I just wanted to apologise because today's meeting was actually meant to be have our annual accounts and our annual external audit report reported today. Unfortunately, the conclusion of the audit's been delayed. Audit Scotland have made me aware of this just a couple of weeks ago, and there's two reasons that they've delayed the audit, and we discussed this at Audit and Risk on Tuesday. So Audit Scotland are obviously suffering from some resource issues within their auditing team, so they're struggling from a staffing perspective. And also, they would like to conclude the testing within East Lothian Council before signing off on the IJB audit. And the audit director, John Boyd, came to our audit and risk committee, and we've had the discussion. But I just thought it'd be worth docking in case any members were expecting. We were expecting to bring the accounts today. So I do apologise that we've not made that September deadline. And I'll just go on to our quarter one report, which is today's paper. So today's report is the quarter one financial forecast update for 23-24. And this report lays out the financial forecast undertaken by our partners, East Lothian Council and NHS Lothian. It provides an update on our financial recovery plans progress and includes the IJB's general reserve position for noting. So the report starts by reminding members of the IJB's budget offers from partners at the start of the year, and this is laid out in figure 1. Within the report, and it totals our starting budget totaled at £182.6 million. Both partners have undertaken their quarter one financial forecasting exercise, and this is reported here today within figure 2. The forecast has the IJB projecting a significant financial overspend this year of £8.5 million. Now, this is a significant level of overspend, and the main drivers are laid out in the papers. So overall, the health budgets of the IJB are projecting a £3 million overspend, and this is made up of prescribing, which is projecting a £1.8 million overspend, and our set-aside budgets, which is projecting a £2.3 million overspend. It's worth noting that there is a national issue with the implementation of a new system, which has meant there's only 1 month of prescribing data. So the projections above, which I've just referred to, are based on NHS Lothian's financial plan information at this stage and will be refined when actual data has been received by NHS Lothian. Within the set-aside budgets, drug costs are driving a significant overspend, and this is shown within the IJB's delegated set-aside, particularly within gastroenterology. Plus, there's ongoing staffing ongoing staffing costs in relation to bank and agency requirements across both medical and nursing staffing within our set-aside budgets. It's worth noting that within paragraph 3.8, NHS Lothian has received additional Scottish Government funding to support sustainability and new medicines funding, and NHS Lothian are going through a process to allocate both these funding streams. It is likely, however, that some of the new medicines funding will be allocated to delegated services given the pressure reported on drugs budgets within set-aside services. So the IJB should hopefully see a benefit once these funding streams are both allocated. Further to this, and in previous years, NHS Lothian's Director of Finance and the Chief Finance Officers continue to have a shared ambition that providing that NHS Lothian can achieve a break-even position in 23-24, then an additional payment will be made to the IJB to meet the final IJB year-end overspend within the health services. The social care overall forecast is reporting a £5.5 million projected overspend. Now, that's a significant swing from our 22-23 year-end position, where we actually finished with a really small operational underspend within our social care budgets. The main areas reporting an overspend within social care are commissioned services, particularly care home placements, and with our learning disabilities budgets, where we have significant, we have a lot of high cost individual packages. There is also a regression, though, that the social care forecast is probably slightly pessimistic, and with more data, the forecasting assumptions will be refined. We have actually had our operational finance meeting earlier this week, and the projections are now looking at closer to a £3.9 million projected overspend within our social care budgets, which may improve further if the council approve any passporting through to the IJB of the additional funding received to support the pay settlement of local authorities. The report moves on to provide an update on our financial recovery plans with a summary shared at Appendix 2. And you'll see in Figure 4, we've tried to lay out the original Q1 forecast and the further things which may benefit the position as we move through the year. We still need all of these finalised by partners, and we'll know more at Q2. Given the significant overspend, I did think it'd be helpful laying out the IJB's general reserve position. And Figure 5 does highlight this with our starts with our opening balance, which I have to say is obviously still subject to audit, given that our accounts haven't been concluded yet. It shows the commitment made by the IJB supporting the purchase of analogue to digital alarms. And the table also highlights the IJB's reserve policy for members. Again, a reminder, this is a policy of the IJB, and it aims for the IJB to hold a minimum of a 2% general reserve. As mentioned, projections will be refined at Q2 and reported back to the IJB. And the only outstanding clarification that we require confirmation from the Council of the passporting across of the additional Scottish Government funding to support the pay settlement to the pay budgets of the IJB. And I'm happy to take any questions.
Thank you. Peter?
Yeah, thanks, Claire. Comprehensive as always. What control mechanisms are available to us, if any, for set aside? And what control mechanisms are there available to us, if any, for care home bed allocation?
So in terms, I'll take the care homes one first. That's obviously something that, as a partnership, Fiona and the team are actively looking at, and they're looking at just putting in a piece of work, some extra controls, extra escalation processes, if required, to see if there's a way that we can bring those placements back down within affordability levels. They have actually came down naturally since the Q1 was reported. So we've got the team just under a little bit of extra scrutiny around the commissioning of these placements. In terms of the set aside position, we don't operate as an HSCP. We don't operationally manage those set aside budgets. They're managed through another business unit within NHS Lothian. What we do as a finance function, though, is we do ask for colleagues to come, and I think we've had a colleague attend our strategic planning board to give a bit of a presentation around set asides, and that's something that we'll look to routinely kind of bring back to the board, to give the board a little bit more detail through the strategic planning group around what's driving the set aside position. There's not a formal mechanism, Peter, in terms of getting back to set aside. It's really just having the kind of ongoing discussions and the ongoing expectation and that shared ambition with NHS Lothian that actually, if the set aside budgets do overspend, there will be an additional contribution to the IJB to break them even.
Did you want to come back in, Peter?
Yeah, if you don't mind, just quickly. Thanks very much, Claire. I'm obviously aware that there's significant pressure on the care home bed situation, and it's not easy. So it would be interesting to see what impact bringing us back in line would have on other areas, and I'm sure Fiona and her team will bring that to us as and when they've got that information. But just on the set aside, I think it would be helpful if we could do as you've suggested has happened in the past and get some more insight into whether or not going forward there are any opportunities for us to influence how that money is spent. That might be a long shot, but I know it's a feature that continually gets pressed home hard when you meet with other IJBs across Scotland, that there's a lack of ability and a legally delegated function for us to do anything with that. So I think the more insight we can get into that, the better it would be for us.
I can make that request, Peter, yep, and get somebody along. Yep.
Thank you. David?
Yeah, can I just confirm that the reason for the adjustment or the lateness of the accounts is down to a resources issue at Audit Scotland, and there's no indication that our accounts are at risk?
Yeah, that was the feedback that the audit director provided at audit and risk, is that it was down to a staffing issue and the concluding of the testing within the council. I mean, Fiona Ireland's the chair of audit and risk, so might just want to confirm, so I don't want you thinking this is just me saying this, but he did feedback that they didn't see, I mean, they've not concluded our whole accounts process.
Yeah.
They've been through the first draft and he didn't raise any issues with the IJB's annual accounts.
Brilliant, thank you.
Okay. Do we have any other questions? Claire, at the meeting of IJB's chairs and vice chairs, there was the finance officer from Glasgow Health and Social Care Partnership, and she mentioned in her, you'll see in her presentation, that there's been engagement with Scottish Government around the challenges, and I think it was helpful to summarise that from all the integration joint boards. I just wondered if there's anything coming through from those around kind of use of reserves or clawing back of reserves at all.
No, I mean, so that would be Sharon Waring, she's the chair of our CFO national section as well, and we have been doing a lot of work as a CFO section and as a CFO executive group to feed back into government. So there was obviously a report pulled together, between a joint report at budget time between chief officers and chief finance officers to share just the position and the challenging financial position that was facing IJBs across the country. And that was shared with all various parties, so COSLA, directors of finance and government colleagues. I think there's an ambition to potentially, once they've done, we have to do quarterly returns into the CFO section as well. And I think there's a shared ambition that actually there's a reiteration of that report, just to share how challenging some of this is. A big risk. I mean, there's big risks that sit everywhere. You know, the local authority pay settlement not yet having been concluded, or prescribing budgets. They're all things that are difficult to control in a quick manner, to put in quick mitigation factors.
Okay, thank you. And just around the financial recovery plans, are different departments carrying out their own integration impact assessments on those recovery plans?
Yeah, we've had a review of all the recovery plans to see, and we've assessed them around what is just an operational recovery plan and what is something that would be strategic change or service delivery change, and therefore we would need an impact assessment. But right at this moment in time, most of the schemes fall into the category of just operational management at this stage. We've not yet went into something where we needed a bigger impact assessment. I think it's likely though that Shameen, when we move into 24-25, we've probably done everything we can with the operational savings, and I think it's likely to go into the service delivery change or the strategic change type of savings programs into 24-25, and therefore impact assessments will be required. Yep.
Okay, thank you. I don't see any other hands up for any questions or any comments. Just to say thanks for the report, Claire. It's good to see that some of the areas where you've mentioned about the 5.5 million might be 3.9, so it'll be good to keep an eye on that process. And I think from the meeting yesterday, I think we still have to continue highlighting the challenges that IJBs face, but also for us in East Lothian, hand in hand, the census report of the demographic changes that we face is really important. And Sharon was keen to keep raising awareness of that, all opportunities possible. And I suppose just to feedback that we did have the Deputy First Minister come to East Lothian to see the amount of growth, etc., that was happening around the county, and that gave us the opportunity to highlight the Health and Social Care Partnership and IJB challenges that we face. So I think we're doing that at every opportunity that we can. Okay, I don't see any more questions, Claire. So this requires no roll call, as it's the recommendations are for noting. Are we happy to note them?
Yes.
Okay, move on to agenda item number 5 was the interim appointment of Chief Finance Officer. Is that Fiona Wilson?
It's Paul Curry, that's me, who's going to speak to that. Just 1 second till I find my paper. This is a short paper for the IJB setting out the process by which the IG is being asked to allow for the temporary appointment of the Chief Finance Officer / Section 95 officer. The reason for that is that there's a vacancy being created by Claire Flanagan's departure, and in order to be able to take time to appoint substantively, the intention is to find an interim post holder to cover the duties of the Chief Finance Officer. So the paper sets out the background, the regulations and other requirements on IGBs regarding the appointment of the Chief Finance Officer, Section 75 officer, and it also talks a bit about the fact that our Chief Finance Officer, Section 95 officer, is a joint appointment between East Lothian IJB and Mid Lothian IJB. Therefore, the process that's going to be entered into with the approval of the IJB will be in conjunction with Mid Lothian colleagues representing Mid Lothian Council and East Lothian Council representatives, as well as representatives of NHS Lothian. So the background just says a bit about that process now. It was carried out on the last time that we followed this process. There is no need for any engagement because of the fact that we, as an IJB, make our deliberations available on the public website for East Lothian Council. There has been engagement to date with IJB partners, which are named being Mid Lothian Council, East Lothian Council and the Health Board, and they don't feel there needs to be any further engagement. There's no policy implications for the paper, and there's no need for any impact assessment or directions. So the IJB has been asked to accept 3 recommendations. The first one is to agree to the proposal to recruit under an interim arrangement a new Chief Finance Officer, Section 95 officer on an interim basis, to delegate authority to the Chief Officer and Chair of the IJB to approve the interim appointment on the IJB's behalf, and to accept that an update on the outcome of this process will be provided at a future IJB meeting. Thank you.
Okay, thank you, Paul. Do we have any questions for Paul? Nope, no questions. Any comments? No, thank you, Paul. I think that's we're happy to approve the 3 recommendations there, because that's a crucial role for us. But just to say thank you, Claire, for your the Chief Officer role that you've played to East Lothian IJB, and I think sometimes we've benefited of you covering both authorities, which hopefully we're able to move on that same vein. So thank you very much for your contributions over the past number of years, and we wish you all the very best in your new role. Okay. Are we
Chair,
happy?
can I just confirm it's a roll call vote for this item?
Yeah, that's a roll call.
Thank you. I'll just go through the members. Councillor Akhtar.
Agreed.
And Councillor Gilbert's not present. Ms Gordon.
Agreed.
Ms Ireland.
Agreed.
Councillor McFarlane.
Agreed.
Councillor Maguire.
Agreed.
And Mr Murray.
Agreed.
Thank you. That's the recommendations confirmed unanimously.
Okay, thank you. Move on to agenda item number 6, which is changes to the IJB membership. Is that yourself, Fiona Wilson?
Yep, that can be me. So the purpose of this report is to inform and seek approval from the IJB regarding the changes to its non-voting membership. This is around the IJBs are asked to agree the appointment of Dr. John Hardman as a non-voting member of the IJB for the maximum term of office, agree the appointment of Sarah Gosner as a non-voting member of the IJB, replacing Lorraine Cowan in the role of Chief Nurse for the maximum term of office, and finally to note the appointment of David Hood as a non-voting member of the IJB, replacing Ian Gorman in the role of Head of Operations within East Lothian Health and Social Care Partnership. Thank you.
Thank you. Do we have any questions or comments? No, thank you very much for the report, Fiona. I think we want to take the opportunity to thank Lorraine Cowan for all her work and contribution that she's made to East Lothian IJB and East Lothian Health and Social Care Partnership, and wish her all the best in her new role, because I think she's moving on to NHS Lothian for a period of time, and to welcome Dr. John Hardman as a non-voting member. That's going to be a really important role for us from our presentation that we received about primary care services, and having that input as we move forward. So to welcome to you, Dr. Hardman, and we look forward to David Hood joining us at the beginning of October. Okay. This paper is also, John, did you want to come in?
Yeah, just to mention that I and pass on my apologies for not being able to be at that last development meeting in relation to primary care. I was disappointed it clashed with my annual leave, but really keen to be involved in those discussions on an ongoing basis. So thank you.
Thank you. I think a follow-up from that, we did feel that there would be more development sessions specifically focusing on the challenges and how we support them. Okay, thank you. This is a paper that requires a roll call.
Thank you. Councillor Akhtar.
Agreed.
Ms Gordon.
Agreed.
Ms Ireland.
Agreed.
Councillor McFarlane.
Agreed.
Councillor Maguire.
Agreed.
And Mr Murray.
Agreed.
Thank you. That's the recommendations approved unanimously.
Thank you. Move on to agenda item number 7, which is the East Lothian IJB Revised Joint Integration Scheme 2023. And is that yourself, Paul?
It is, yes. Thank you very much. Members will be aware of previous descriptions of the process by which the previous IJB integration scheme, which was initiated in 2015, was requiring to be reviewed. The paper goes through a bit of detail in the slight toing and froing around the process for the review of the integration scheme, which was thwarted somewhat by the arrival of COVID and the changes to a variety of deadlines that IJBs and others had. But eventually the process was started, and the handling of it was done on behalf of the IJB, in effect by NHS Lothian and East Lothian Council, with the lead being taken by the Strategic Planning Department of NHS Lothian. The engagement process was set out under statute and was commenced in March 2022, the 1st of March 2022, and concluded on the 31st of March 2022. And it was happening at the same time across the other 3 IJB areas. So NHS Lothian, in effect, was managing the review of all of the schemes. And I think through that process, we've ended up with schemes that are very similar in their detail within. The IJB itself does not have a role in the development of the scheme review, or indeed in the revision of the document, but they, as members of the IJB, were informed of the process and invited to engage with the consultation process itself. So their views, along with views of other consultees, were included in the drafting of the new document, which is attached at Appendix 1 and runs to some many pages. It's interesting to note that the scheme wasn't approved until later in 2023, but was in effect backdated to May of 2023, as is highlighted on the first page of the integration scheme. The document itself is pretty legalistic in its language, but very clearly sets out the duties and obligations on the partners of the IJB and the IJB itself. And it's certainly worth a close read, I think, for members of the IJB to understand some of the opportunities that the document brings and some of the limitations to the responsibilities as well. So there are 4 recommendations, only for noting, as I say, the document itself isn't for approving. So the recommendations are that the IJB notes the process for the development of the scheme and the delaying factors, notes that although the scheme was only formally received in July, it does backdate officially to May of this year. The there should be a review of the integration scheme in 2028, unless otherwise directed by Scottish ministers. For example, if there are legislative changes, and I suppose the big thing that might be on the horizon is the National Care Service, which might cause changes to any scheme that's operating at that point. And finally, to note that the revised scheme was presented for information to the East Lothian SPG in August of this year. Thank you.
Thank you. Do we have any questions or comments for Paul? Peter?
Yeah, thanks very much, Paul, and I concur entirely with your suggestion that we, I think I said this the last time, that we are familiar with the content, but in particular, can I suggest that we perhaps hold a mirror up to ourselves in terms of the values that are described on page 5 of the integration scheme, page 31 of the papers. I think it is, maybe it's not 31 actually, because I'm looking at a different version, but certainly page 5 of the integration scheme. There's a couple of areas there that are of particular importance and I think of great significance. One around the people's social and economic circumstances, which lead them to having poorer health and well-being and life chances than others. And it suggests that we should be tackling these inequalities, focusing our efforts on those at greatest risk. I think we should hold a mirror up to that particular aspiration. We should also, where there is financially pressured environments, remind ourselves that, as said in the 5th bullet point, then a single health and social care economy for East Lothian, we will invest the resources of the health and social care economy wherever it will have the greatest impact on meeting our shared objectives. So I think that is an important area for everyone within East Lothian, not just IJB, to be conscious of when Fiona and our team decide how they're going to spend their money and how best that money is divided up across the area to deal with the significant challenges that they face within their remits.
Thank you, Peter. Do we have any other questions or comments? No, I echo your comments, Peter, around the importance of doing those integrated impact assessments of how some of the decisions that we're making will impact on people, and also fully understanding the services that we provide and being able to measure the positive impacts that we're having on people in a whole range of on gender, on poverty, disability, etc. I think those are important elements as we move forward. So for today, the main areas were to make the references in there up to date, and the changes following the revision to the scheme in 2019 to reflect the Carers Act consequentials were some of the main changes made in there. Okay, I don't see any other hands up or any other comments or questions. Okay, this report is just for is recommendations for noting, so we don't require a roll call, so we're happy to note this paper. Okay, thank you. Move on to agenda item number 8, which is the East Lothian Community Hospital Ward 5 Orthopaedic Rehabilitation, and I've got Guy Whitehead here down, but I'm not sure I can see him on the screen.
No, it's me, Shameen, that's going to be delivering this paper.
Okay, thank you.
Okay, thank you. The purpose of this report is to inform IJB members of the development of NHS Lothian's use of Ward 5 in East Lothian Community Hospital for the provision of inpatient orthopaedic rehabilitation as part of its orthopaedic recovery plan. The ward opened to the first 8 patients week beginning the 4th of September this year. The background to it is that the COVID pandemic significantly impacted on NHS Lothian surgical waiting lists, and that was as a result of postponements and cancellations of non-urgent procedures. This has left a backlog of elective surgical cases being developed and patient waiting times increased, potentially affecting healthcare outcomes. So we've seen an increased health and social care needs for patients on waiting list, creating additional demands on resources. The development of the inpatient orthopaedic rehabilitation provision at East Lothian is part of the NHS Lothian's orthopaedic recovery plan, and the plan is funded through the elective recovery programme and focuses on 2 key things. the expansion of unscheduled care orthopaedic rehabilitation capacity, and ring fencing of elective orthopaedic capacity. It's estimated that these initiatives will result in an increase of elective arthroplasty, so hips and knees, of approximately 800 procedures across the year, across the Lothians, and prorated at an estimated 465 for the fiscal year. And the provision is for the elective orthopaedic patients from across the Lothians transferred from the Royal Infirmary post-operatively to East Lothian. The provision has a number of benefits. It supports the acute sector around the backlog of Lothian patients, but also includes our own East Lothian patients. It reduces the waiting times, helping to prevent patient conditions deteriorating, and this results in better outcomes for people. It enables East Lothian patients to benefit from post-operative inpatient rehab closer to home, and it also just reinforces that East Lothian is designed as a rehabilitation hospital, making it well placed to provide this type of provision. And it just provides a development for an opportunity for the hospital to become a centre of excellence for orthopaedic rehabilitation. So the recommendations that the IJB are asked for is to note the development of, by NHS Lothian for orthopaedic rehabilitation inpatient provision at East Lothian Community Hospital, and also note the positive impact of this development for East Lothian residents and for the community hospital itself, and that funding will be through the elective recovery programme with no direct financial implications for the East Lothian IJB. Thank you, Chair.
Thank you. Do you have any questions for Fiona? Peter and then Elizabeth.
It's not a question, Sinead, it's just my wholesome support for what's been done here. I think it's an excellent use of the hospital, and I'm not seeing any adverse comments to that effect from those that are in the medical profession. So I'm going to assume that everybody that's in that particular line of work on the call agrees with that sentiment. So I think we should applaud the work that's been done and recognise the potential value of it to East Lothian residents.
Thank you, Peter. Elizabeth?
Thanks. Just first of all, I was going to say something similar to Peter, so I'll echo that. It seems like a really great development, and congratulations to everybody involved in that. The only question I had, and it's perhaps too early to tell, I was just wondering, do you have any idea roughly what percentage of the people using this ward will be from East Lothian, or is that just something that only time will tell? Thanks.
Yeah, so I don't have an indication. I think I suppose just to highlight, if I may, Chair, just some of the work has been done as a really good piece of work across both colleagues from acute and those from the other partnerships. What we're doing it is on a list basis, so that it's that who's ready first, rather than prioritising, you know, it's East Lothian, it's who's ready, and we're working. They've created a 2:30 flow huddle. So at this stage, we don't know. Of the 8 patients that are in there just now, 4 are from Edinburgh, 2 are from Mid Lothian, and 2 are from East Lothian. So if that just gives an indication, but we really want to go on ready to move date, so that actually we don't get into, the important thing for us is, for a Lothian perspective, is to get as many people through the list, so that actually the benefit to not only us in East but the wider Lothians is gained. So we're trying not to be fixed on, well, these 2 beds are East or these 2 beds are Mid. The thing I'd like, and I'm hopeful, and we could maybe get Jen Jarvis to share, is we've had some really good feedback from patients already, and actually they're great patient stories that I would hope we could share with the IJB just as an early indicator, and even just some of the work that Jen Jarvis has done around the kind of comms of, this is how long it takes to get from the Royal Infirmary to East Lothian Community Hospital. I think it's even opened the eyes of our acute colleagues. So some really positive work that is probably not reflected in the paper that would be useful to share with IJB members, just so that you have a sense of feeling of the work that's done collaboratively through this process. Thank you.
Is that okay, Elizabeth? Okay. John, I'll take you first, because it might be on this point before I take you, George Maguire.
Yep.
Was it on this point, yep. John, you wanted to come in? No, okay. George Maguire?
Yep, thanks. I mean, just a simple question of clarification for my own. Is this going to be operations, knee replacement, and hip replacements being carried out?
No, so we're not carrying out the surgery ourselves, because we can't do that, but we are what the design is, that we support people off the acute site so that more people can get the surgery, and we do the rehabilitation within East Lothian Community Hospital. So the bit when you don't need the acute element of the medical specialist needs at the Royal Infirmary, you then come and you step down to our orthopaedic rehab, and we're really well designed for rehabilitation within East Lothian. And hopefully I'm encouraging Jen to share the videos. You'll just see what an opportunity people have and the feedback that they've got already. So hope that's clarified it.
Yeah, that clarifies it. Thank you. I just got excited thinking there was going to be nearly another 1,000 replacement operations being carried out. Thank you.
Well, we want to contribute to that because we do want to improve it, but not us ourselves.
Thank you.
Jennifer Jarvis, did you want to come in about the videos?
Yeah, just very quickly to say that I've shared the YouTube links in the chat for everyone, that they can get access to them. They're all live and available. And they at the Royal Infirmary, they are being shared with patients who are being allocated to East Lothian and shared with their family members as well before they come out here, because we have had some patients that have been slightly resistant to come. And so far the feedback has been is that these have been beneficial to them as well.
Yeah, thank you. John Hardman.
Thanks, Shameen. It was to, I guess, respond to Peter's query about whether there was any medical satisfaction in relation to this, and very much there's a lot of we're convinced that this is a really good move. I think it's been a little bit of a brave move as well, because I know of other areas within NHS Lothian that were reluctant to take on this this project, but I know that our medical teams have done an awful lot of work in the background, making sure that this is all done very safely, and that there's clear patterns in place and governance to ensure that it's all done very well indeed. And to sing the praises of Leslie Berry's rehab team as well, because they've done a remarkable job in taking a very, very proactive approach to rehabilitation, with the aim of getting people home as soon as possible, because getting people out of hospital obviously is good for bed days, but it's also really good for patients if they can be rehabilitated effectively and not waste time sitting in bed. I heard a really good report anecdotally on patients that were on the ward last week who were going to bed tired and ready for a good night's sleep because they've been working so hard at rehabilitation during their time on the ward, which sounded completely appropriate and good for people. So it all sounds like it's going really well from that perspective. Thank you.
Thank you. Thank you, John. Any other questions or comments? Can I ask a question around, I know that recruitment's been a challenge. Could you maybe say some of the efforts made to address some of those recruitment challenges, and how we keep the workforce there to be able to continue that work?
Absolutely. So workforce remains a challenge. We're not unique in East Lothian to that. Tracy Leishman, the clinical nurse manager, has put in huge amounts of effort, particularly around kind of from a recruitment point of view of Ward 5 and separating it out from other orthopaedic rehabilitation. Part of the limiting factor to 8 beds just now is the workforce. But we've got an incremental plan around, there'll be another 4 beds in October, another 4 beds in November as we recruit staff. So we are recruiting staff. We've got all of our non-registered staff, but it's the trained staff, that band 5 level that we're working towards. So even a conversation this week, we've thought about how else we could get our comms around recruiting people. So that is, you're right, Chair, that is the real challenge around this, the workforce question. But we've worked through an action plan. We're still keeping at it, but and I've got a plan for opening up an additional 8 beds, but we need to get it up to 24, and that relies on trained staff.
Okay, thank you. Do we have any other comments or questions? No, I don't see any other comments and questions. I think it's a really positive move. I know during COVID East Lothian, IJB and Health and Social Care Partnership always played an important role in helping the bigger system, and that's just an example of that. I think we need to keep an eye on the recruitment and the workforce there, and just supporting people to get home as quickly as possible. And just take this opportunity to thank Leslie Berry and her team for all the work that they do in supporting people with the rehab to be able to get home as quickly as possible. Okay, this is not a paper that requires a roll call, so it's just a note for noting. So are we happy to note the paper?
Yes.
Agreed, thank you. Move on to agenda item number 9, which is a Royal Lothian InReach project at the Royal Infirmary of Edinburgh. Is that yourself, Laura?
Hi, yes, it is. If you're happy, I'll just share my slides. Okay, hopefully everyone can see that. So good afternoon and thank you for inviting me along today. My name is Laura Rowlandson. I'm a clinical lead physiotherapist in the rehab service and the digital and informatics lead as well. So I'm just going to provide a brief overview on the InReach project that the rehab service is running at the Royal Infirmary. The first phase of this commenced at the end of October last year, and that phase ended at the end of March, and we're now currently into the second phase of the project. So just to provide some very brief background, the project was developed in response to the request from our Chief Exec to all partnerships to review how they could enhance their support to the acute in planning for winter last year. An enhanced partnership approach allows us to support the transfer of some of the risk and responsibility from the acute to the partnerships. So within East Lothian, we proposed a small team of allied health professionals from the rehab service would work clinically in the Royal Infirmary Monday to Friday. This would be alongside our daily activity huddles, which commenced in July last year. So looking at some of the data of the project, initially this was within existing resources. So we had occupational therapists, physiotherapists and assistant practitioners. And as we've moved into the second phase of the project, we received Scottish Government funding from the unscheduled care. And that has continued to be the same team of OTs, physios and assistant practitioners. So the first phase of the project and the second phase of the project, some of the key activity data is within those two columns. So in total, we have case managed over 700 patients. We've completed over 4,000 interventions and we've discharged just under 500 patients. And this has included 200 patients through our discharge to assess pathway. We've been able to approach the project with a really agile approach to respond to whatever the clinical need has been. And this has allowed us to respond to the data in the first phase of the project and then move the focus of the team within the second phase to where that data has shown our biggest impact, which has been towards the front door. It's also worth noting that within the project, we have used over 31 different resources on discharge. And this has been really key to ensuring that we can support that creative discharge planning. So looking at the impact of the project, I'll briefly discuss two areas, the discharge to assess pathway that I mentioned and our activity within A&E. So prior to the project, the Royal Infirmary discharged on average 5 patients with the discharge to assess pathway in a week, and those patients had an average length of stay of 16 days. During the project, this first phase, they continued to discharge on average 4 patients a week with discharge to assess, and their average length of stay remained 16 days. On top of these patients, the InReach project team discharged an additional 5 patients a week with our discharge to assess, and their average length of stay was 5 days. So this has allowed us to have mitigated costs within the project of savings of just over 1,300 bed days, which would then upscale to an annual just over 3,000 bed days. And that would equate to, during the project, savings of around about £500,000. So in addition to the discharge to assess, our activity at A&E we've really closely monitored. In that first phase of the project, we completed 61 assessments, and 57% of those patients were discharged directly home from A&E, or 74% from A&E and AMU. Now, during phase 1 of the project, we relied on our acute colleagues to refer the patients to us at A&E. And we identified this as a missed opportunity for us to intervene earlier. So through collaboration with our analytic colleagues, we've developed reports that run twice a day that go directly to the team to say, to identify East Lothian patients in A&E. And this allows us to assess and intervene earlier. So although the InReach project is a small resource within a much larger health system, we do anticipate that with the improvements in pathways and outcomes, it will be reflected in that whole system. And therefore, throughout the project, we have looked at a really comprehensive range of data metrics shown on this slide to allow us to monitor this. And of note, the readmission data for East Lothian sits at around about 9% for general medicine and medicine of the elderly, and that's for our over 65s unplanned admissions. And the East Lothian InReach data, our readmission data, also sits at 9%. So although we are supporting earlier discharges, our readmission data is stable. And finally, so as a partnership, we've been able to successfully respond to the request from the acute due to the rehab service and the partnership being a very agile workforce. We have a really data-driven ethos and a flexible culture to allow us to successfully implement and evaluate that first phase of the project. It's allowed us to develop where our key focus for the second phase will be. And we want to focus on that early intervention and monitoring of patients. And this is involving us ensuring that we're screening all of those patients as soon as they arrive into accident and emergency. Then, even if we're not picking them up, we are then remaining a point of contact for the acute team to support them in considering the more creative discharge options for these patients. And as we move through this phase, we will continue with that really robust and transparent data collection and liaison with our Lothian Analytic Services data team as well. That's a brief overview of the project. So I'm going to stop sharing my screen. And I'm happy to answer any questions.
Thank you. Do you have any, Peter?
Yeah, thanks, Laura. Good piece of work. I'm sure it's going to prove beneficial beyond what you've already told us. Can I make two suggestions? One, that we perhaps not only identify the costs, but the anticipated savings that may somehow be accrued. I know that's going to be a difficult measure to make. I think it's important that we do kind of balance it out by how much we think would have been spent had this not been in place, rather than just identify the costs of implementing it. And the second thing is that when the evaluation, or perhaps later on the evaluation, that we offer this up as a project within the central database that I believe Shameen will recognise from our input yesterday, exists within Scotland for good practice ideas to be shared and potentially, if appropriate, picked up by others and deployed if it's deemed to be so successful and sustainable as I suspect it will be.
Laura, do you want to come in on any of that?
Yeah, I might pass over to Fiona if she wants to comment on the next stages.
Yeah, happy to. So we have already flagged with Scottish Government the work that we are doing. So we're in close kind of collaboration with them. There is something that, you know, Callum Campbell, Chief Exec of NHS Lothian, is keen. How do you broaden this out? How do we get the impact? Because as we recognise, East Lothian is small. How do we get the broader impact? And we are doing a piece of work through the Unscheduled Care Programme with the other 3 partnerships and colleagues at the Royal around how we could do something over winter. I suppose one of the key things this does is really kind of challenges kind of culture, roles and responsibilities, the kind of understanding of where kind of assessment and rehab takes place, and that can't be underestimated. And with that, we've worked with Tracy Gillis and Alison McDonald just to design a discharge framework so that we're clear on that. So always kind of that feedback loop and listening. But it's already, we're trying to kind of roll it out wider or influence it wider with support from colleagues in Scottish Government, but also just share the kind of the good practice of where we have been already and refining it.
Okay, Peter, did you want to come back in?
Yeah, very quickly, Siobhan, because I know there's others want to speak, but the sharing aspect that I spoke of, Fiona, I recognise what you've said there, but the particular department that I was referring to covers the integration work, and it would just be perhaps worth checking that it finds its way through to them and not just into an area of Scottish Government that don't necessarily see the advantages of the integration. Oversight, Scottish Government, civil servants, that's the best way to describe them, a very poor way to describe them, but you know what I mean. I think they would be the best conduit for this.
So they're aware, because we work with them, and Andy Hall, who's supporting Laura, as part of that department.
Yeah, no, I echo that point made. One of the things we were asked about the IJB chairs and vice chairs with civil servants about good practice, and they seem to be looking for that. And we were saying to them, well, there's already there. You just need to speak to the networks that are there and to ask the question, you know, give that to us. So it sounds that would be really helpful if you wanted to send it to them and any others within Scottish Government that are, for example, working on the National Care Service, that look, this is an example of integration that's working well and making a difference. Did you want to come back in?
Yeah, absolutely. And we have shared it. Even just in the summer, we had a visit around those policymakers working on the National Care Service. We have shared these pieces of work. I think one of the things that was interesting from last winter, it's back to, I think we talked about Ward 5 about being brave. We shared it when at times we've had pockets of money, so we were looking for funding further. And there is a little bit, I sometimes worry that we default to, you know, the same old things, whereas this is innovative project. So even when we are talking to civil servants, you know, are we better going with interim beds? No, not for East Lothian. We're better doing this at the front end. So it is shared, but I suppose it's how do we get, is that shifting the balance conversation even further, the being brave around doing something different, because we know the traditional methods of things like interim care home beds doesn't really answer our question or solve our problem in Lothian, never mind East Lothian, because it just then has a cost to us and a tail longer, whereas what we want to do is get the intervention, the prevention, and that kind of early access of what we know is behind that big front door in East Lothian. And if we could do that, scaling it up with all 4 partnerships in Lothian, what a difference that potentially could make. So,
okay, thank you. And Claire McIntosh?
Yeah, thanks. I'm probably making a very similar point around the hearing of it, a really brilliant project from a front door perspective. I think the problem at the front door is when the different postcodes have different interventions. Clinical teams do not hold that data at all, and the easiest thing is always going to be to admit. So there needs to be either a repository of intervention that is easy to understand from a clinical front door perspective, or the same intervention across the whole of all the partnerships, and that would be absolutely brilliant. But I particularly really like the assertive case finding and not relying on the referral from the front door clinical staff, and that I think will make the really biggest bit of difference to these. But it's a brilliant piece of work. Thanks.
Okay, thank you. Was there anything on that you wanted to come back on, Laura or Fiona?
No, I suppose just Claire, I'll send you that kind of discharge framework for comment. It's just in draft form, but I suppose it's how do we influence the confidence, because there is a challenge around and Claire, I mean, many don't know, but I was an OT on Claire's area at one stage. It's about the kind of the roles and responsibilities and that shifting, and it's okay that the partnerships do the assessment. You tell us what you think they need because it's important. We hear that from an acute perspective, but actually allow us to support the discharge plan. And I suppose it's just looking from a clinical leadership point of view and yourselves as IJB members around how we just support that change, because for some it's a bit uncertain of what that means. But it actually has demonstrated good outcomes for people in East Lothian in this case. And Claire, very much hearing you around that consistency across the Lothians, and we are trying to do that through the programme. But anything you can help to influence would be fantastic.
Okay, thank you. John Hardman and then Maureen Allen.
Thank you. Going on what Fiona said about this being brave and innovative, I agree it's an excellent project. But I know one of the issues inevitably with any team coming in is going to be stepping on toes and putting people's noses out of joint. And I know, you know, of course, that's been a challenge. And I wonder what Laura would say about what learning there is from that, and whether there are things that you've learned in this process that could be passed on to other teams embarking on this kind of project in the future, how to share that, and how to create the environment in front door departments where everyone is able to accept that kind of support and intervention, you know, to get the patient journey better at the end of the day. Thanks.
Just a small question, John. There's been lots of learning, and so my background, my largest clinical background is the Royal, and I think it's been really positive in that going in I already knew a lot of the clinical leads and the managers as well, and that has been very positive. I think in East Lothian we're very innovative, we're very forward thinking, we like change, we move fast, and it's accepting that not everyone has that approach to services and the change in service delivery. So a large amount of communication has been needed, and I think some of those relationships we're still building, and that's going to be an ongoing process. But trying to get them invested in it as well, and that this is an opportunity for us to enhance the profile of AHPs. And if we can do that, not only do we enhance the profile of AHPs, but we're going to have a positive impact on our local population and support them to get home quicker and to get their recovery, their rehab in where they want, which is at home as well. So I think going into the next stage, it's continuing to build on those relationships and just taking things maybe slower than we would like to, but knowing that if we can get the buy-in from the clinicians as well as the managers, then the success of the project is going to be greater.
Thank you. And Maureen and then Leslie.
Thanks, Sinead. I actually just wanted to say we've been part of lots of journeys through Leslie's team, and I think one of the most positive things is the whole system bit, because actually it's not just about AHPs, it's actually about the community coming along with it as well. So we have the community first team that work alongside Leslie's teams and build that community capacity, look at community services, do the bit. It's a really good partnership. So again, it's about the learning and taking that forward. I just wanted to throw our hats into the ring as well, because I think over the years it's been a long slog for some of us, but we're actually getting there, and it's a really positive environment, not just for the staff, but for the patients at the end of the day, or the individuals that come through all our doors.
Thanks, Maureen. And Leslie?
Just like to agree with Maureen completely. We could not do this without third sector and all our other partners. As I say, those 32 options other than care are a real mixture, and we couldn't do it without the support of the community in East Lothian. So that is key here. But the other thing is, just to answer, which Laura won't say, yes, it's been difficult at the front door and the wards. However, we agreed at the beginning we'd be totally professional, that we would turn the other cheek and we would keep going. And I think that I would compliment my service on the ability to remain professional at all times, no matter what. And that has paid dividends. And now those relationships are working. We are beginning to get an understanding. Things are improving. So I just wanted to put my tuppence worth in there to thank the team for their consistent professionalism.
Thanks, Leslie. Do we have any other questions or comments? I just wanted to ask Laura, I think kind of the most powerful are the case studies of the individuals and the patient feedback. And I think that's on page 123. I think that's a really powerful part of the report. So I think it's got to be around what difference it's made to the people that are coming through the door and what difference it's made to their life, and then not further on down the line not having to be readmitted. Are you planning to do any more around the patient feedback and what impact it's had on being able to do other things, and as a result maybe not going into hospital but accessing other interventions that would prevent them going back into hospital?
Thank you for the kind words there. Yeah, the case studies are just wonderful to read, and we had so many to pick from. Our team have been keeping a little bit of a library of all of these, so that come our next report, and we'll do a 6-monthly report, which will be due next month. We'll add in some new case studies to the next report as well, and just looking at those pathways as well. So yeah, we will include that.
Thank you. Peter, did you want to come in?
Yeah, I'm just hoping, Shameen, that the minute can capture two important things that have been said amongst many other things, but two particularly important things. One is what Leslie said in a way that's acceptable to the minute, that there have been some challenges associated with working together on this work that need to be reconciled going forward. And the second is Claire McIntosh's point around the consistency of this across the 4 areas. And it shouldn't be beyond, I hope I'm going to sound really naive here, it shouldn't be beyond what's an obvious potential benefit to everybody for us to navigate our way through individuals' challenges against what they believe to be the correct way in a changing environment. So I hope we can record that in a minute, and I hope that Fiona can take that into the centre and be persuasive in taking this beyond the borders of East Lothian.
Okay, does anybody want to come back on that?
Yeah, Chair, I can come back. Absolutely, Peter, and I suppose the other hat I have is the unscheduled care programme chair. We are trying to do that, but it's and we've got meetings. We've got a kind of plan for winter, but there is a huge kind of a cultural issue of taking people with us and the pace people want to go at. We're very, very fortunate that CMT are hugely supportive of us within NHS Lothian, but it's the level of the kind of probably a bit of the middle management and the maybe less so the clinicians on the ground of that, the kind of opportunities. So it is a work in progress. So it has been taken back, but it's the ability to influence wider. But we are fortunate CMT are very supportive. So yes, we are doing that, but it's not, you're definitely not being naive, but it is difficult just in the areas that Laura outlined around the kind of where we are as a team in East Lothian and where other partnerships are. But to be fair, it's an ambition of all partnerships across Lothian around how we shift that balance of, so it is working with acute colleagues, and we're very fortunate with Michelle Carr as Chief Officer, who's a huge supporter of us as well.
Okay, thank you. I just wanted to ask a question around the recommendations. You mentioned in there that this will continue till March 2024, and you've indicated the resource implications for that. Could you maybe just say what plans you might have for the next steps, or will you be waiting for the research to be able to determine what the next steps are going to be?
Sure. So I'll speak and Laura can correct me if that's okay, Chair. So we have unscheduled care monies that will support us through to that date. We need the data to evidence what we're doing. We also then need I guess a contingency plan, because that's where I think we get into the set aside discussion around actually our use of beds, length of stay, and we have really good data behind us. So the unscheduled care monies allows us to develop it, but then with that, I think it allows us, one, the challenge around set aside and that shifting, and that's part of that wider conversation we're having just now actually around kind of where the HP assessment is, et cetera, but also the changes that we make in the background around this. So are there, one of the big things, and we've touched upon it earlier, is around we want to send more people to their own homes, not to care homes. So actually it impacts on the number of beds that we have in our budget for care homes, but actually is there a drive around care at home? So all of that is in the mix. But I think we need to look at the next step we would be looking at is set aside, but we need that robust data to be really sure of what we're doing, and that's where it's really important we have got Scottish Government colleagues alongside with us, because Laura should get huge credit around the data on this, and we're one of the few partnerships that have got somebody with this expertise as an AHP in data, but we need that to be robust, because when people are uncertain, it's what they pull apart. Do you want to just add to that, Laura?
No, I think you did wonderful. Thank you, Fiona, for taking that.
Okay, thank you. I don't see any other comments or questions for. No. Thank you very much for this report. I think it's really powerful report, especially around the number of bed days that you've prevented where people don't want to be staying in hospital. And I think the whole one of the key elements of integration was seeing that change, that shift in the system, and that ensuring people, and it's more imperative that we do that in East Lothian than ever when we look at our demographics of where we're going. So I think that there's that, but also I think whichever groups of staff you're working with, the patient feedback has to be instrumental, that it had a positive impact for the individuals, and that is our whole purpose, is to provide care to people closer to home, and tackle health inequalities. And hopefully what will come out of your report is where those people are being supported that are from East Lothian, and what other interventions and supports are available in those communities, for the point that Maureen has made, and how we work seamlessly with our partner organisations. Fiona, did you want to come back in?
Yeah, just to support you. I suppose I'm just reflective of some of the work around kind of the older people's engagement we've been doing, and I suppose I was reflecting actually how do we get that story out there about what East Lothian is doing for East Lothian people around that kind of pool. I was at Trinent and Elphiston on Tuesday night, and just people were not aware of the attention and engagement we were having around trying to support East Lothian people out of acute hospitals, support them to be at home, and just where I think we're unique as a partnership that we've been able to do that. So I suppose I'm just quite reflective from this conversation and the engagement work around how we share that, because this is about East Lothian people, what we're trying to do, and get them to the right place. So I suppose it's just that community engagement of the story we're trying to tell as well. So thank you.
Okay, Jennifer Jarvis, do you want to come in?
Yeah, just very quickly, feeding off the back of what Fiona's just said there, is that we've now got this comprehensive report from Laura and the rest of the ELRS team, so I can certainly take that into a press release and get that issued out and circulated more widely, and promote all of the fantastic things that they're doing.
Okay, no, that'd be really helpful. I think maybe taking nuggets out of the report that will resonate with people and they'll understand. Okay, this paper does not require a roll call. It's recommendations, just to be noted. Are we happy to note the recommendations and get feedback from you from beyond March 2024? Thank you, Laura. We're happy just to note the recommendations. Okay, thank you. That is the end of our agenda. I just want to thank you all for your participation and coming along today. Okay, thank you very much. Hi, Marilyn.
Thanks, Shameen. Everyone, bye.
Shameen, I was just wondering, under any